So
What did you think about my symptoms and then the immediate change of my?
it's been incredible, and I've lived with this and have seen Mike suffer with this for so many years now. And to find Dr. Darido, and I've had friends that said, well, no, that's a bad surgery and bad outcome. But the problem is they didn't have Dr. Darido.
And the uneducation of it.
Yeah, and what
the
I
mystique of acid reflux and reflux in general.
Yeah, exactly. And the thing about it is, as Mike said, he didn't just jump into the surgeries. To the surgery. He had what was it, laryngoscopy that he had, and then the other tests.
Manometer.
Just to make sure, as well as question
No
him.
matter how obvious it was, he refused to accept the obvious until he did every possible research
Exactly.
in the peripheral perimeter of the whole thing. Since
Right.
you couldn't go down, and it's not something you can absolutely determine, but just say, oh, okay, let's do a test, and he's got it. You can't tell that.
And so to see the change in Mike has been
In 1 week.
In 1 week. 1 week only.
Yeah.
And the change
Only
in
liquid diet.
Yeah, but it's don't, when people say, oh, the hardest part is the diet, it's really not.
Not at all. You're actually on it with me.
Yeah,
You're
and
my little
so
warrior.
and it's really not, and it goes by quickly, and the difference in the energy, the difference in not being dragged down by having things in his throat that he just couldn't get rid of. And
did it improve my personality?
Well, it hadn't done that yet, but we're getting to that. No. But
Give me
the
a
thing
couple
that's
more.
amazing is to go into the different doctors and to say, I think I have LPR, and then they say, oh, we'll just take Prilosec. And then I started reading on Prilosec, you can only take for 14 days, and then you have to wait 4 months. I'm like, you gotta be kidding me. And so, and I don't.
And just dismissed it as an issue.
Yeah, it's
really an issue.
dismissive. And
push the pharmaceutical
absolutely.
aspect of it rather than the corrective
Right.
process, or even alarm over the notion that you might have a condition that needs to be attended to, rather than just drive-by shooting, so
Right.
to speak, and give me medicine or something. It doesn't solve the problem.
Well, and the other issue is, I told Dr. Darido, they call LPR the silent reflux, and I think it's silent because no one's ever heard of it. And it's the first time I've ever heard. When I found LPR, I had never heard that word or those letters.
Let's give credit to the cardiologist, Dr. Ellis, who said,
Yeah,
when I mentioned about coughing, he said, oh, there's 3 reasons why you're coughing. He said, it'd be acid reflux, allergies, and one other thing. But it's the first time I've ever heard the word LPR.
yeah,
And he took it seriously.
right. So this has been life-changing.
That's miraculous.
It's been, and the experience has been pretty painless.
And my understanding is the younger you come in and check it, the stronger your tissue surrounding what normally there's a hernia, what they call the hiatal hernia. There's an opening that's allowing the enzymes or whatever to escape up into the esophagus.
Right.
The younger you have, the better your tissue, the easier for Dr. Darido to work with that tissue rather than have to use a mesh, because this acid can deteriorate,
Right.
disintegrate tissue that surrounds it. They need to reinforce and close that opening with. So the younger you can come in, the more important to do it.
Well, we're thrilled, and we couldn't be happier.
It's miraculous.
It is, and it is
because even Dr. Darido is also a well-kept secret.
Yeah.
As well as the world knows who he is,
Mm-hmm.
the fact that that's not a household name, constantly a household name, and this epidemic of this issue. And it's unfortunate that he may be the only expert that there is.
Well,
and he said a great phrase. He said, "I and the esophagus are one."
Are one.
Because he's not only a doctor, he's not only a craftsman, but he's an artist.
Well,
and think about Cindy, as he should have mentioned, every stomach is different.
Mm-hmm.
Everything is different. The art you need to really be a great surgeon, you have to be artistic. You have to be imaginative and creative, because everything is different.
Right.
Like mine, being an athlete, I have a little bit different tissue. He was able to work with mine, but he's had other people similar with less tensile strength in their muscle, and he's able to resolve that as well. Pretty lucky, aren't we?
We're blessed.
We thank God every day for Dr. Darido.
This has been, I prayed about this and for a solution, and Dr. Darido and
how you ever were motivated to
Yeah.
to go deep and drill down and find that out. On that one phrase that he mentioned something
Yeah,
about
about
acid
the
reflux.
endoscopy.
And the fact that you didn't just blow that off is just
Right.
stunning, really.
Yeah, and it was, after going to every specialist, and then that was our only, that one little thing, I said, well, because after you ate, you would cough a lot, and I thought, well, let's see if it was related to acid
And-
reflux, which you never had
Well, and
heartburn.
the irony is, I'd say, let me eat some more, because
Yeah.
when I would eat, I was pushing it this right direction. And so it preclude the coughing, because I was actually pushing food down here. As
Right,
soon as it would rest, then it would start working.
That's right.
And by the way, what do you think of his team?
love everything about this place, the people are very caring, they're,
The efficiency, the professionalism.
anytime you call,
And even the hospital where we go,
Yeah.
all the team,
Yeah.
it's so first class, I've never seen anything like it. And
to have a medical issue
Yeah.
and to have such a great experience from start to finish is,
the
you don't normally.
thoroughness of Dr. Darido, dribbles down to everyone
Yeah.
who's associated with him, so.
Because you don't normally associate a medical problem with a great
So
experience.
would you
This has
recommend
been great.
Dr. Darido, would you shout his name out to the world? Would you shout out would you shout out looking for this issue, even
Yeah.
if you don't know the symptoms?
Yeah.
LPR,
Yeah.
LPR, acid
Whether you
reflux.
have LPR, GERD, whatever all the
Yeah.
things are, I don't wanna be an expert in, acid reflux, but we've become that.
Yeah.
And I'm just, I'm very grateful and blessed.
Thank you, Dr. Darido, you're the
Thank
best,
you.
we love you.
Thank you.